Do you have plantar fasciitis? Then this may be the video for you. My name is Mike Keenitz, and I'm a PT assistant. Today I'm interviewing Rick Olderman, who is the author of the Fixing You book series, and he is a physical therapist. We're going to be talking about common causes of plantar fasciitis and things you can do to try to prevent it or treat it if you already have it. If you want to listen to the full interview, make sure to check out the description box below. All right, now we're going to switch on to the subject of plantar fasciitis. So, what are some of your tips and tricks for treating it, and maybe explain what plantar fasciitis is to some people?
Sure. So plantar fasciitis is often felt as a burning sensation on the bottom of the foot, especially those first few steps in the morning. People are feeling like a tearing kind of feeling happening down there. And then it'll go away. And then maybe in the afternoon, they'll start to develop a little ache. And then, or maybe that just goes away too. But then the next morning it comes back and it tends to get progressively worse and worse until they can't seem to get it to go away. A lot of people have tried, steroid injections and all sorts of things in their feet, and it just hasn't helped or only helped temporarily. So again, this comes down to understanding what's going on from a systems standpoint. So if you've had plantar fasciitis, you've probably been told, hey, you need to stretch your calf and soleus muscles. And so you stretch your calf and soleus muscles, but the next morning they're tight again, and you have your plantar fasciitis, and you can stretch all day long and they would be tight again the next day. And this happened to me as a physical therapist too. I was scratching my head. I was like, what is going on here that these calf muscles keep getting tight again? And then I finally realized it's because of how we're sleeping. So most people, when they sleep, their feet are pointed, their feet are pointed away from them like this, instead of in a neutral position like this. So if you sleep on your stomach, the bed's going to push that away. And if you sleep on your side, you'll notice that typically you point your feet downward. And then if you sleep on your back, the covers are pointing the foot down like this. So you have 6 to 8 hours of calf and soleus shortening occurring during the night. And so then you wake up in the morning and lo and behold, your calf muscle is tight again. And when you try to step on that and your knee is passing over the foot, because it's so tight, all that force of your body moving forward is going down into the arch and tearing that plantar fascia and irritating it and hurting it again. The solution is to lengthen the calf and soleus, but you'll never do it by stretching. So I use something called a dorsal night splint that you can find commonly on Amazon. And if you order one of these things, what it's going to do is hold your foot into a neutral position while you sleep at night and not allow it to point away and the calf and soleus to shorten. Usually within a week or so, the plantar fasciitis will go away because you've solved the length issue of the calf and soleus complex. Now, some people, this is just a passive shortening of the muscles, but there are others who are actively contracting their calf and soleus muscles at night while they're sleeping. These are the more of the tense people, right? And so they're going to especially hate wearing a dorsal night splint because they're going to be actively pushing against it, and it's going to create all of this burning and discomfort in the calf and soleus muscle. Well, you know what? You've got to break that habit because that's what's ultimately causing the calf and the plantar fasciitis in the first place. So bear with it. What I often tell people to do is, especially if you get up in the middle of the night to go pee, just put on the dorsal night splint for the second half of the night instead of the whole night, and start that way to start weaning yourself onto this thing. Once your pain goes away, you can start weaning yourself off the dorsal night splint too. You don't have to wear it 7 nights a week for the rest of your life, just as much as you need it. So that would be the one of the first things, and that's where the rubber hits the road. That solves most people's plantar fasciitis. So then we have to look at what the second thing is. Why is the calf and soleus becoming tight? So the calf and soleus is often becoming tight because we are locking the knees straight when we're standing and walking. So when the knees are locked backwards, it shortens the calf and soleus muscle, causing tightness there. So breaking this nasty little habit of locking your knees whenever you're standing and walking will go a huge way to solving your plantar fasciitis and helping it to never return again. So those are the two things that are easy to do at home. And then in my home program that I've developed for foot and ankle pain, I show a third way because a lot of people, their feet collapse too easily. The bones are too loose and so forth. They have flat feet, or there's too many forces trying to push down their foot. And so they need a little bit of help. And I've developed a very effective taping technique that lifts the arch. It's unique. It's not found anywhere else. And what it's designed to do is offset this spiraling force that's traveling down into the foot that is causing the foot to flatten and therefore irritate the plantar fascia. So if the other two things are working, but not quite all the way, you might need a little bit of extra support from a taping technique to support the foot arch more precisely while you're solving these other problems. And usually, I mean, taping the foot arch up usually solves the pain almost immediately right off the bat. And then as we solve these other things, we wean the tape from the patient. So you won't, again, it's like the dorsal night splint. You won't have to tape forever. You just have to tape until you restore the normal forces acting through the lower body system.
Do you still wear the night splint?
I do not. I don't know. I have never dealt with plantar fasciitis.
Oh, okay.
So
what do your ankles do? Mine go down like you were talking.
Mine go down, but see, I don't lock my knees when I stand.
Oh.
And I'm not one of those people who tends to be excessively tight. So this is the combination, especially guys, as we get older, we get tighter. And so this is women too, but men especially become especially tight. So as we get older, these systems start to tighten up more and more. And so plantar fasciitis will develop as people get older as well for that reason as well. So not everyone needs to wear a dorsal night splint. It's only for if you have plantar fasciitis. By the way, this also works well for heel spurs or Morton's neuromas too, because those things are formed due to these excessive forces acting through the foot and ankle as well.
Yeah. Because your calf turns into your Achilles tendon, which turns into your plantar fascia. Isn't it all
correct
connected as one piece? And people
You're
don't really realize that.
Yeah. Fascially, it's all one system.
Is that why people get calf cramps when they're sleeping? Because it's constantly in the plantar flex position?
So a cramp typically happens when a muscle is put into a shortened position and then asked to contract. So the people who are getting calf cramps, their calf and soleus is already in a shortened position, and then they add the component of actual contraction on top of that. So it's not just passively shortened, there's an active contraction there too. If you're a person who gets lots of calf and soleus cramping at night, well, this is then telling you why you're having plantar fasciitis, because you're actively contracting your calf and soleus muscles while you're sleeping. So the dorsal night splint will break you of this habit.
This is all making sense to me. It's kind of weird that I never thought about this before.
Well, see, Mike, this is what I get. Like, I've trained many therapists at my clinic, and this is when I talk to all of my patients, they're just like what you said, this makes perfect sense to me. No one's ever really explained it to me like this before. And this is because we're not taught to think this way. But when you do think this way, it makes perfect sense, which always perplexes me why no one else has come up with this before. So it's not like I'm some genius. I guess I've just been more patient with trying to unravel all of this than most people. And that's why I created my online training program for health and wellness practitioners too, because it is so much simpler to solve pain thinking this way.
So which one of your books should someone look at if they have plantar fasciitis?
Yeah, so I have a foot and ankle pain book, but that hasn't included the observations I've made in my clinic these last 10 years. So I would recommend the foot and ankle home program, which has the taping techniques. By the way, the book doesn't have the taping techniques for the foot and ankle. So the home program has the taping techniques. In the members area, you'll have the link to the dorsal night splint that you can purchase from Amazon if you want to. And then I show a technique to help you learn how to unlock your knees during the day while you're standing and walking, which, I mean, I had one person, her plantar fasciitis reduced by 75% in 3 days, and she had it for months just by getting her to unlock her knees. In 3 days, it reduced 75%.
I'm a knee locker.
Yes.
Bobby yells at me sometimes.
A lot of people are.
It's subconscious. I don't. When I notice it, I change it. But when I have a
well, you bring up a really good point, Mike. Is that a lot of these movement errors that we have are subconscious. They're unconscious. But the problem is that they are a naturally occurring unconscious pattern. So our brain doesn't know to change them. And so if you don't know that what you're doing naturally is wrong, why would you ever try to change it? Right?
You don't
Because your
think
brain
about it.
doesn't know that that unconscious habit is causing you pain. Only your body knows. And your body hasn't and brain haven't made that connection yet. And that's what my programs do, is help you make these connections so that you understand, oh, when I do this, it hurts. And when I do this, it feels better. Now I need to do this. Do it like this from now on. And that's, if you can do it like this from now on, that pain will never come back again.
Sure. And we'll link, for people listening or watching, we'll link everything in the description if you want to find your online programs or books, or if they can, you still treat some people, right? Online?
Yeah, so I sold my clinic back in April of this year. So I'm under a non-compete clause right now for several years. But I help people via telehealth. I can do that, but I can't see people physically.
Sure. Makes sense.
Yeah. But as you can see, I get great success even not seeing people physically, because all of this stuff is, I can just see what's going wrong. I can, I have these tests that show what's wrong and what isn't and so forth. But really, I haven't designed this so that you need to see me. I designed my whole program so you don't need to see me, because I put literally everything in there that you could possibly need to solve your pain.
Right. Is there anything else you want to add about plantar fasciitis?
Just like everything else, you can solve this. I don't care how many practitioners, shots, or procedures you've had to try and solve this thing. You just have not had the right information. And I can almost guarantee, I can't remember a plantar fasciitis case I haven't solved. It's just, once you understand how this all works, it just becomes more simple to solve. You can do this.